To understand high blood pressure, we first need to understand what blood pressure actually means. Blood pressure is the force of blood pushing against the walls of your arteries. Every time your heart beats, it pumps blood throughout the body. That pressure is necessary. Without it, oxygen and nutrients couldn't reach your organs. The two numbers. When you measure blood pressure, you usually see two numbers. For example, 120/80. The first number is called systolic pressure. That's the pressure when the heart contracts. The second number is diastolic pressure. That's the pressure when the heart relaxes between beats. General blood pressure categories. Normal, less than 120/80. Elevated, 120 to 129 systolic, and less than 80 diastolic. Stage 1 hypertension, 130 to 139 systolic, or 80 to 89 diastolic. Stage 2 hypertension, 140/90 or higher. Hypertensive crisis, above 180/120. Very high readings may require urgent medical attention. Why blood pressure rises? Blood pressure can rise because of narrow blood vessels, excess salt intake, stress, obesity, lack of exercise, genetics, smoking, kidney disease, hormonal issues, poor sleep. Sometimes there is no single cause. Why high blood pressure is dangerous. Here's why hypertension matters. Imagine constantly overfilling a water pipe with pressure. Eventually, damage occurs. The same thing happens inside the body. Over time, high blood pressure damages arteries and organs. Effects on the heart. The heart must work harder. This may lead to enlarged heart, heart failure, coronary artery disease, heart attack. Effects on the brain. High blood pressure is one of the biggest risk factors for stroke. It can also contribute to memory problems,
cognitive decline,
vascular dementia. Effects on the kidneys. The kidneys contain tiny, delicate blood vessels. Hypertension can damage them slowly over time. Effects on the eyes. Blood vessel damage in the eyes can affect vision. The silent nature of hypertension. Many people feel completely normal. That's why regular blood pressure checks are so important. Signs and symptoms people ignore. Most people with high blood pressure have no symptoms. But in some cases, people may experience headaches, dizziness, blurred vision, nosebleeds, fatigue, chest discomfort, shortness of breath. However, these symptoms are not reliable. Some people have dangerously high blood pressure and feel perfectly fine. Emergency warning signs. Seek urgent medical care if high blood pressure is accompanied by chest pain, severe headache, confusion, weakness, trouble speaking, severe shortness of breath, vision loss. These could indicate a medical emergency. What to do immediately if your BP is high. So, what should you do if your blood pressure reading is high? Don't panic. Stress and anxiety can temporarily increase blood pressure. One high reading does not automatically mean disaster. Sit quietly for 5 minutes. Relax. Then measure again. Check properly. Many readings are inaccurate because of poor technique. Before checking blood pressure, avoid caffeine for 30 minutes. Avoid smoking. Sit with feet flat on the floor. Support your arm at heart level. Rest quietly beforehand. Monitor regularly.
Keep a log.
Track readings over time. Morning and evening readings can help identify patterns. Reduce salt intake. Too much sodium can raise blood pressure. Common hidden sources include fast food, chips, processed meats,
instant noodles,
sauces, packaged snacks. Drink water. Dehydration may affect blood pressure balance. Avoid excess alcohol. Heavy alcohol intake can raise blood pressure. Contact a healthcare professional, especially if readings remain consistently high. Do not self-medicate without guidance. Best foods for high blood pressure. Diet plays a major role in controlling blood pressure.
Let's talk about foods that help.
Fruit, bananas, oranges, berries, apples, watermelon. These foods contain potassium, which helps balance sodium. Vegetables,
spinach, broccoli,
tomatoes,
carrots,
cucumbers, whole grains,
oats,
brown rice, whole wheat bread, healthy proteins,
fish, beans,
lentils,
nuts,
low-fat dairy. These provide calcium and protein. Now, let's look at foods to avoid. Foods to limit: fast food, processed food, chips, excess salt, sugary drinks,
fried foods,
processed meats. Always read food labels. Many packaged foods contain hidden sodium. Doctors often recommend the DASH diet. DASH stands for Dietary Approaches to Stop Hypertension. This eating plan focuses on healthy foods while reducing salt intake. Natural ways to lower high blood pressure. The good news is that lifestyle changes can significantly improve blood pressure. 1. Exercise regularly. Walking, jogging, cycling, and swimming are excellent choices. Aim for at least 30 minutes most days. 2. Reduce salt intake. Avoid adding extra salt to meals. 3. Lose weight. Even small weight loss can improve blood pressure. 4. Manage stress.
try,
Deep breathing, meditation,
prayer,
relaxation exercises. 5. Stop smoking. Smoking damages blood vessels and heart health. 6. Sleep properly. Adults should get 7 to 9 hours of sleep. 7. Drink enough water. Drink plenty of water for better blood circulation. 8. Reduce caffeine if sensitive. Some people experience temporary blood pressure increases after caffeine. Healthy habits practiced daily can make a huge difference. High blood pressure is serious, but it can often be controlled with the right habits and medical care. Start taking care of your health today. Check your blood pressure regularly. Eat healthy foods. Stay active. Manage stress. And consult your doctor when needed. If you found this video helpful, please like, share, and subscribe to the channel.